Thank you for joining us at today's welcome event for the Royal Surrey NHS Foundation Trust. We look forward to meeting all of you as new doctors in the KSS Deanery, and we hope that this presentation helps you choose Royal Surrey for your foundation training.
We are the Royal Surrey. We're a clinically led NHS trust providing joint-up care, bridging the gap between hospital and community services. Many of the services we provide are world-class, and we aspire to deliver even more in the future. Our compassionate, caring and friendly colleagues make up our Royal Surrey family. We all have a passion for learning, continuous improvement and excelling together. There are great things happening every day in our wards and departments and in the homes of people across Surrey. We help tens of thousands of cancer patients, giving them access to cutting-edge treatment and technology. But we're not just about specialist care. Each day, thousands of people access our services for emergency care, help with lifelong conditions, or welcoming new lives into the world using our outstanding rated maternity services. And our world-leading research is helping to find the treatments of tomorrow. We have ambitious goals, including working together towards zero harm and delivering on all nationally set targets.
Yes, of course we can. Let me see if I can find a nurse to help you.
We're also focused on improving population health and the patient experience, as well as reducing the cost of care per person. Getting there means putting one of our core values, quality improvement, right at the centre of our strategic journey. Why not become part of our Royal Surrey family and work with us? Or become a member? Tell us about great care, but also where we could have done better. Be part of our and your Royal Surrey story.
The question you're now facing is why Royal Surrey? Reasons you may choose Royal Surrey are the location, the hospital, the foundation program, teaching and simulation, and the pastoral care available at Royal Surrey County Hospital. Royal Surrey is located in Guildford, a town in the southwest of Surrey. Guildford boasts many attractions including a beautiful high street, proximity to London, and also the nearby Surrey Hills area. Guildford Town is a historic town centre with all your basic shopping needs. In terms of nightlife, there's a giant spoons and a huge pub culture. There are also loads of options for dining with both independently owned and larger chain restaurants. Guildford also has quick access to London with a direct train to Clapham Junction that will get you there in only 30 minutes. There is also good connections by train to coastal areas such as Brighton and Chichester. The surrounding areas are also known for their green spaces. Not far from the town centre are the Surrey Hills, an area of outstanding national beauty. In terms of walking and running, St. Martha's Church and the Newlands Corner are nearby. Frensham Pond, the River Way are also close to Guildford. There are also some national trusts and gardens, including Winkworth, Arboretum, Gatton Park, and RHS Wisley. The hospital itself is a 520-bed district general hospital. Royal Surrey is a leader in oncology, upper GI surgery, HPB surgery, and urology. It is also a specialist centre for diabetes at the Cedar Centre, ENT, and maxillofacial surgery. A name you might recognise is Professor Timothy Rockall, who created the Rockwell scoring system, attempting to identify patients at risk of adverse outcomes following a GI bleed. Professor Rockwell currently works in our colorectal department as a general surgeon. Royal Surrey is generally a very friendly and well-staffed hospital with great relationships between the doctors, nurses, and admin team. We also use online notes, Cerner, and Surrey Safe Care, and online prescribing. In terms of social events, the junior doctors at Royal Surrey have quite an active schedule. The Social Club, which is just across the road from the hospital, provides the perfect venue for gathering after work to catch up with colleagues and to meet others who work in the hospital. The Doctors' Mess hosts monthly events where junior doctors are encouraged to get together and bond. This improves morale and collaboration within the working environment. Royal Surrey encourages all their doctors to get involved in research both locally and nationally. Some of the more prominent pieces of research are displayed here. For those moving to the area, the hospital accommodation can be found right across the road from the hospital. It costs approximately £500 to £600 per month. The average renting cost in Guildford is about £500 to £600 per month. Living in hospital accommodation is a great chance to house share with other F1s and F2s. For those who are commuting, our hospital is an easy commute from South London via the A3 or via train. Moving on to the foundation program itself, we would like to introduce you to the F1 and F2 program directors.
Hi, I'm Julie Coles. Thanks for listening to the Royal Surrey video. And I hope you're considering the Royal Surrey as one of the trusts you'd like to work in for your foundation program. I'm the foundation program director for F1. I've been at the Royal Surrey for quite a long time, and I've been looking after the F1 doctors for over a decade now. I'm an orthopedic surgeon as well as being foundation program director. The Royal Surrey is a great hospital. It's a really good place for your first year as a doctor. We have world-class cancer services, but we are a DGH and we're small enough that you will feel like you're part of the team and you belong when you work here. Guildford is close enough to London that you can commute from London, but it is a great place to live. We have a great start off to the year. You have ILS and a 7-day shadowing program where there's lots of teaching from outgoing F1s on how to survive and how to log in and how to make everything work. We give SPA time to F1s, which is not something all trusts do. So you get some time to sit down at computers and do some of the mandatory training that you are required to do either by the trust or by the foundation program. I hope that you decide to work at the Royal Surrey and that you really enjoy it. Okay.
Hi, my name's Bhav Patel. I'm a consultant anaesthetist here at the Royal Surrey at Guildford, and I'm also the programme director for the Foundation Year 2 Doctors. I'm a London trainee, and then I've been here a consultant here for the last 16 years at the Royal Surrey in Guildford. The Royal Surrey is a great place to work. We are a 500-bedded district general hospital, but we have a teaching hospital feel to it and provide a lot of services that teaching hospitals provide as well. We're a tertiary specialist centre for cancer care, so that's a catchment population of 2 million patients in Surrey and Sussex, and that includes upper, lower and lower GI, HPB, gynae oncology. We've got a large oncology centre at St Luke's, as well as ENT and maxillofacial cancer and non-cancer surgery. We have 15 operating theatres, and including that, there are 3 Da Vinci operating robots because we specialise in minimally invasive surgery. We've got very strong links with the University of Surrey. We have 7 professors of surgery, 2 professors of medicine, and we're a specialist centre for diabetes, hepatology and gastroenterology. Our GP practices are great. We've got a mixture of city-based and rural-based practices. Our foundation year 2 doctors have a great experience there, and we've got some excellent GP tutors with close links to the hospital. Farnham Road is our acute mental health hospital trust, and our foundation doctors have a very positive experience going there. Our education centre is here based at the Royal Surrey. It's very active, lively. It's slightly separate from the main hospital, so it gives you that area where you can rest away from the main hospital. There's a wellbeing cabin, an outdoor seating area for lunch for some fresh air, and also excellent staff within the postgrad education centre. Guildford is a great university town. There's plenty of bars, restaurants, theatres, music venues, and also London is only a 35-minute train ride to Waterloo. So look forward to seeing as many of you as possible. Thanks. Bye-bye.
On this slide, you'll see some of the rotations that are available to you at Royal Surrey. One thing that sets us apart from some other programs is that we don't have just a general surgery block. These are divided into 3 different sections: upper GI, hepatobiliary, and colorectal. This allows for more specialist education for foundation doctors. Another unique feature about our foundation program is the acute internal medicine rotation. Nearly all the F1s at Royal Surrey will have this rotation during their first year. You could be split into 3 different departments: EAU, Guildford Ward, or the acute frailty team. This rotation has a heavy on-call burden, but it's an excellent opportunity for you to practice independently. On-call shifts may include surgical twilights, surgical nights, medical clerking shifts, and EAU ward cover of both days and nights. It is an amazing learning experience, and most F1s that have this rotation speak fairly highly of it. It also has a bonus of paying very well. For those looking for leadership opportunities, we have many available. Some of the examples of F1 rep roles we have are the F1 representative who attends meetings on behalf of all the F1s and represents them, mess representatives who organize mess and nights out, handover, F1 induction, doctor's toolbox, EAU, teaching, program fair, career, referral, and well-being reps. Simulation is a big part of your development during your foundation years. Royal Surrey has a state-of-the-art simulation suite, which every foundation doctor gets to use at least twice a year. There is also an NHS Ready course for international graduates. F1 teaching occurs every Wednesday and F2 teaching is every Thursday. These are protected times for your education with a variety of topics presented by knowledgeable professionals each week. There is also weekly grand round presentations for medicine. At the hospital, you have access to the library on site 24 hours a day. On top of all these opportunities, there's always ward-based teaching provided by seniors with content applicable to each particular job.
The Medisim Centre is a state-of-the-art simulation suite located at the Royal Surrey, which delivers high-quality and innovative simulation to trainees both here and in the surrounding areas. We use the latest in simulation technology to deliver high-fidelity scenarios, including a simulated lung and ultrasound simulation. Our simulation mannequin has a number of features such as breath and heart sounds, reactive pupils, pulses, and much more. He also blinks, breathes, and speaks, increasing the realism of the scenario. The Sim Centre faculty comprises consultants from many specialties, registrars, simulation fellows, foundation doctors, and highly skilled sim technicians. Every foundation doctor is invited to 2 half-day simulation sessions each year. We continue to receive excellent feedback for these sessions, and foundation doctors in particular find them extremely useful learning opportunities.
A workforce that's happy, healthy and ready to achieve is an absolute must-have for the Royal Surrey. Which means it's no surprise that health and wellbeing is such a significant area of focus for the Trust. Louise Hall, Director of Human Resources, explains.
It's a key issue for all of us in the NHS and as citizens to look after ourselves, and particularly when you've got a profession where you've got lots of people who are very good at caring, we're not always so good at looking after our own health and well-being.
We know that we have some incredible people that work for us here and they're so dedicated to looking after the patients, but this doesn't always reflect in the way they look after themselves.
So we've got a new health and wellbeing lead.
My role is about developing and supporting the implementation of the staff health and wellbeing strategy.
The strategy has been co-produced by the Royal Surrey's own workforce. They have set the vision, objectives and priorities for the next 2 years.
And we've prioritised 3 different areas. One is around mental health.
The idea of the new mental health and wellbeing policy is to try and break down the barriers individuals may have around talking about mental health. It's okay not to be okay. So Royal Surrey want to support staff who may come forward and say that they, for whatever reason, they are struggling with their mental health and wellbeing.
We've already started running sessions for managers about how they can help their staff with their own mental health.
We've trained over 100 line managers in mental health awareness.
We've also introduced mindfulness and resilience training.
We've launched our Schwartz Lounge, which is a multidisciplinary platform and a forum to bring people together to reflect upon the social and emotional aspects of working in healthcare.
And we also have meditation drop-in sessions.
We've been nominated for a BMJ award for our Junior Doctors programme, and we've launched several public health campaigns around mental health, including suicide awareness, Mental Health Week, and we've also celebrated Carers Week.
The second priority is environment.
Because when we go into the wards, what people say is they want somewhere to sit, they want somewhere to have their lunch, they want to be able to use a computer, they want some really quite straightforward things. So environment is really, really important.
Part of my role is to make sure that we have enough opportunities for people to take rest breaks, adequate services for healthy food options. They have access to interventions for self-care, prevention and early intervention if they need it. This all very much fits in line with our family ethos and the vision of our strategy, which is to create a You Care, We Care workplace environment.
And the third thing that we're looking at is work-life balance.
We all have lives outside of work. Some of us have care and responsibilities and other home life demands. So in line with our priority for work-life balance, we have relaunched our flexible working policy, increased over 60% of those buying and selling annual leave. We have a pretty impressive staff benefits offering currently via our Viva platform.
We want to work as much as possible to be flexible as an employer and to encourage people to work for us, because we can't afford to not do that and to do the right thing for our staff.
Royal Surrey's focused and progressive approach to health and wellbeing has already received a massive thumbs up from staff. Employees from all corners of the Trust have made it clear that they support this agenda. We are, all of us, determined to help make the Royal Surrey the best place to work, grow and be.
For most of us, the past year has been full of unexpected challenges. Here at the Royal Surrey, we want to help you to get the best out of your time with us, whatever happens this coming year. To help you do this, we have set up a bespoke pastoral support service called Connect. The service is run by a consultant radiologist with a long history in supporting trainees, and myself, a geriatrics trainee, who has had personal experiences of navigating the difficulties of today's training environment. We have junior doctor champions in each specialty to make sure that what we are delivering is suited to the needs of each department. Connect is here to support you through the good times and the bad times. We have a wide range of projects, including providing hot drinks for night shift workers, virtual exercise clubs. Currently, these are a virtual running club and other virtual exercise sessions, and we hope that these may be able to meet in person at some time in the future. We also want to be there when things get tough. We are there as a source of support and information for junior doctors who have had a challenging time. Sometimes this is as simple as having the time to spare for a cup of tea and a chat. If you need more structured formal support, we can help you access the right help. We particularly support junior doctors who have been involved with difficult clinical events. We know that international medical graduates sometimes face an extra set of challenges when they are new to the NHS. We are in the process of setting up an international medical graduate network at Royal Surrey. We are working with current international graduates to provide extra resources and points of contact for newly starting internationally trained doctors. We look forward to seeing you at the Royal Surrey in the future, but if you would like to contact us in advance to find out more about Connect, please do get in touch.
Before we wrap up this presentation, we just wanted to go through some of the frequently asked questions. Will we be at the same hospital for F1 and F2? This entirely depends on the job you are allocated. The majority of jobs at Royal Surrey will have you at the same hospital for 2 years, with a minimum of 1 community placement during your foundation training. There are also some jobs that have you working 1 year at Royal Surrey and another year at another hospital in KSS West, such as Frimley Park or Ashford and St. Peter's. Do you have any nights and on-call shifts? As we spoke about earlier, you do have nights and on-calls right off the bat from F1. Most of our junior doctors really enjoys these, and they are often very well supported. This also prepares you for your future practice of ongoing nights and on-call shifts. Communication gave you a bit of insight into the Royal Surrey Trust. We wish all of you incoming doctors the best of luck in your future careers, and we hope to see you in August.